is Shane Kelly. I'm a student here at the College of Nursing, and today I will be performing a wet to dry dressing change. First, I will get my patient's orders and I will verify the orders to do the dressing change. I will then verify my hospital's policy and grab all the materials that I need before entering the room. I will then enter the room, introduce myself, and I will identify my patient with two identifiers. I will use name and medical record. We have Jaguar Jones, medical record 417-6352. 417-6352. I noticed that he is allergic to penicillin. I will go over the procedure with the patient to eliminate any anxiety he may have for the procedure. I will then perform hand hygiene. Hand hygiene is important to do when coming in contact with C. diff or whenever your hands are visibly soiled. Please ignore my dishes. You can use alcohol antiseptic hand rub in place of hand washing when hands are not visibly soiled and when entering and exiting a patient's room. I will turn my sink on and let it get warm. It is warm. I will now wet my hands and apply 3 to 5 milliliters of soap and lather my hands. Before doing this, I would check my hands and nails for any cuts or abrasions and then perform hand hygiene. Clean under each of my fingernails. Rinse my hands. And then I will dry each hand from the tip of my fingers down to my wrist. And turn my faucet off with a paper towel. I will come back over and put on my goggles. Normally in a hospital setting, I will have goggles, but however, I break them, so I will be using my glasses. I will put on gloves. And look at the suture, and I will also remove the bandage. I will expose the bandage on the patient and pull the curtain for privacy, while also raising up my patient's bed and lowering the side rails. My sterile field is not above my waist, so therefore I will be breaking sterility. However, in a hospital setting, I will lift my table up above my waist. I will remove the tape on the bandage, removing it away or removing it towards the wound itself. tape, but okay. I will remove the bandage away from the patient so they cannot see. And I will note the texture, type of drainage, the amount, the color and consistency of the drainage, and the odor. I will now remove the contents of it. And I will note that there is 25% granulation tissue, 25 necrotic tissue, and 50 slough, which is green, tan, and brown discharge. I now will palpate around the wound and note any redness, tenderness to the patient, or fever, redness or swelling around it. I now will crumble up the bandage and properly dispose of it in my glove. And properly dispose of it. I now will open up my dressing tray. Be careful not to touch the top of it and remove my sterile field. And being careful of the unsterile 1-inch border. And I will lay it blue side down. And anything draping below the table will be unsterile. I now will not reach over my sterile field, pick up the contents of my container, not touching the top of it, and dump them out. I will get my normal saline label facing my palm, making sure that it is not expired and it is the correct saline. Open it and pour it gently without splashing. I will now put on my sterile gloves. I will use my non-dominant hand to put my dominant glove on first. With my hand like this, I will go and I will pick it up from the inside of the cup and slide my finger in. Okay, now with my thumb sticking out and my fingers like this, I will go on the inside of this cup, making sure not to touch any non-sterile. Go like this. Okay. I will first start with placing my gauze out, making sure not to put it around the unsterile border, and putting my gauze in the saline. This has touched an unsterile border, So I will throw it away and I will use another gauze. Okay. With the gauze in the saline, I will take one, wring it out, make sure not to get any water on my sterile field, and fluff it. Or no, I will not fluff this, I will wring it out and clean my suture line from least contaminated to most contaminated. So I'll go down one, throw that one away. I'll get the next one, wring it out. Put it around, down, throw that away, and get my next one, wring it out, and clean down, and throw that one away. I will note that the suture lines are intact, there doesn't seem to be any drainage or redness. And now we'll move on to my wound. I will get some more gauze and place in the saline. I will wring these out and fluff these. And place them in. I will be careful not to touch my gloves to the skin or wound. And repeat. You do this wet to dry method to, when it dries, it will collect all the debris. That is why you do not wet it whenever you pull the gauze out, because if you wet it, it will take all of the debris and loosen it back up. Place it in there. Do one more. Making sure not to get my sterile field wet, and place in. You just want to loosely, lightly pack without overfilling. And now I will get a dry gauze and place it over my dressing. I will get my ABD pad, which I am using a paper towel as. Be careful to only touch the outer portion of it, unfold it, and place it over the dressing. I now will take off my sterile gloves, throw them away, facing down towards the trash can, and secure my dressing. Measure the tape, tear it, and apply to the dressing. I am running out of tape, however, normally in a hospital setting, I would just have another roll of tape with me that I could use. Or then on a separate piece of paper, I would write my name, date, my initials, date, and time, so the next nurse will know who did the dressing change, when they did it, and what time they did it. I will clean up my area and wash my hands, perform hand hygiene, and then I will lower my patient, position him correctly, lower my patient, and raise the side rails, leaving one down. And then I will go and document everything I found, any discharge, any kind of tissue, any abnormalities, and I will document how the patient tolerated the procedure.